community advocacy speech, and Gorman. When it comes to growing old, we never really think that it's going to happen to us, but we blink our eyes and here we are, old. So when we get old, there's normally a lot of difficulties that come with the aging process. A lot of the times we need the help of a nursing facility to help us get through life as an older person. This is normally when you look to a long-term resident care facility. Naturally, we want our nursing care facility to be the best possible place that we can imagine, but we don't live in that ideal of a world. There are a lot of perfect nursing homes, but there are also not so good ones as well. What makes a nursing home good isn't necessarily the building, but it's the nurses that are taking care of you, or the CNAs. According to 10 must-have characteristics of a CNA published by CNA Classes Help in 2012, the list of qualities that make a good CNA are compassion, trustworthiness, a good attitude, emotional stability, and professionalism. Unfortunately, this is not the case of all CNAs that are working in the workforce. After becoming a certified nurse aide myself, I have become more aware of the abuse and neglect that occur daily in a nursing home facility. In an article, Signs of Nursing Home Abuse, Home and Abuse, published by Nursing Home Alert in 2013, abuse is defined as an intentional infliction of injury or unreasonable confinement, intimidation, care or service deprivation, and punishment that results in pain, harm, or mental anguish. Nursing home abuse is shocking, painful, and almost always wrong, and we need to be aware of the ways that abuse hurts our society. Today, we will look at the significance of nursing homes, why we should care about the neglect and harm, reasons nursing homes need to exist in our society, and what we can do to help prevent abuse in the nursing homes. First, let's examine the significance behind why a nursing home is so important. I always try to think about how I would feel if I was dropping off one of my loved ones at a nursing home. I try to imagine how I would feel dropping them off, trusting that this CNA would take care of my loved one in a way that I would want them to be taken care of. This is an extremely hard situation to put yourself in, and I know that I would be very worried if that were me in that place. We are all going to come to a time in our life when getting old is really the last thing to do, and that means that nursing home facilities are in high demand. According to statistics and data published by National Center on Elderly Abuse, the greatest number and proportion of people aged 65 and above are at 40.3 million, or 13% of our today's population. This boomer generation effect will continue for the decades. So the generations are growing, people are living longer, and we now have the most old people that we've ever had in the history of time. People need reliable, safe, and nurturing nursing homes to grow old in. And when there's abuse and neglect in these nursing homes, it only complicates the matter by making the family and the patient feel unsafe and taken advantage of. Next, let's look at some more reasons behind behind the harm abuse does to a patient. There is much harm that goes on with the patient, physically, mentally, and spiritually. A lot of the time, a patient that comes into a nursing home is already at a stage in their life when they don't feel like they can take care of themselves by themselves. They are normally cognitively impaired or physically disabled, making them completely dependent upon the nurse or CNA that is taking care of them. For an example of physical harm, we can consider a nurse that might be helping an old woman bathe herself. The CNA might become irritable or impatient because the old woman doesn't move fast enough in the bathing process. So the CNA might decide to go ahead and do it herself, and in the process she might be jerking the old woman around, leaving bruises or marks on the body. This then brings me to the emotional harm. Sticking with the same example of bathing, you'll find that the patient then feels incompetent or like they're a burden on the CNA because they're not fast enough in the bathing process. A lot of patients will go into a state of depression because they feel that they are not adequate enough to be living. And this then brings me to the spiritual harm. So you see, it's a chain reaction, and bad care is the catalyst. One article called Nursing Home Abuse, published by Nursing Home Abuse Center in 2012, says, "The thought of it is disturbing, but abuse to elderlies occurs daily. They are some of society's most vulnerable people, but senior citizens who are perhaps the most vulnerable when their living situations they cannot easily defend themselves in their living situations." Hawes writes, in an elder abuse and residential long-term care setting in 2003, "Many are either unable to report or scared to report this abuse because they think that it will impact their way of living." Next, let's look at why the abuse goes on in these nursing homes. Abuse is something that is never really understood by somebody who is appalled by it. Normally, when somebody hears about abuse, their first reaction is, why are they being abused? How could you possibly do that to somebody? But the truth is that it does happen. So why? Most of the time, in a good nursing home, you'll find nurses that have gone through extensive training and education to become certified. But not all nursing homes require that nurses become certified to work in these facilities. This means that most of these nurses who aren't certified aren't educated, and this means that they don't know the proper way to handle patients that might be difficult for them. You don't have to be a certified nurse to know that you're abusing a patient, but the lack of education of how to deal with a difficult patient is missing with a nurse who isn't certified. A lot of the time, you'll find nurses that are committing this abuse don't have the characteristics that they need of a CNA. Registered nurse, professor, and CNA Stacy McGill says, "You have to have compassion, respect, and patience with all your patients. Too many times I have seen CNAs that just come in for the paycheck, and when the days where it gets tough, a paycheck just isn't going to be enough." Until more nursing homes require that nurses be certified to work in the facilities, this problem of abuse will just continue. Finally, let's look at how we can take this problem into our own hands. These are some pictures of patients that might have been abused. To make sure that this doesn't happen to you or your loved one, there are some things that you can do to prevent yourself or your loved one from getting into a neglectful situation. Ted Sherwood at Sherwood, McCormick, and Robert Attorneys at Law in 2014 writes, "Family members play an important role in the prevention of the abuse or neglected. Loved ones whose family members visit frequently and ask questions demanding quality care are less likely to suffer from this kind of abuse. The negatives to this is that there is no way to be absolutely sure that abuse will not occur. But the good news is that there are many things that you can do to help prevent it." Ted Sherwood writes, "You can pay attention to the other patients. Are they clean? Are they well cared for? Are they happy? You can watch the way the nurses care for the patients. You can make sure that the nurses there are certified. There are many more things to this list, but the key is just to be aware and do your research before you send a loved one to a nursing home. It is easy to do research for a good nursing home. The more time you put into looking for a nursing home, normally the better chances you have of your loved one not getting into a neglectful situation." In conclusion, if you are aware of the ways to prevent abuse in a nursing home, you lessen the chances of a loved one getting into a neglectful place. In review, we looked at the ways that a nursing home is important to our aging society, the reasons behind why we should care about neglect, and how you can help prevent this from happening to you or a loved one. During the last couple years of life, the one thing you want is for your relative or yourself to go in a peaceful way. In a quality nursing home, all the things that you would want and more are available to you. So take the time, look for a good nursing home, and the satisfaction will come when you see how happy your relative is. Let me just show that.